Fibroids are common tumors found in as many as 20% of young women. These are solid tumors, usually benign, that is non-cancerous. They can be found anywhere in the womb, inside when they are called submucous myomas, within the substance or the body of the uterus, that is intramural, or on the outer surface of the womb. These are the subserosal fibroids. Fibroids are extremely common. Sometimes they cause symptoms, sometimes the patient doesn't even know she's having fibroids in her womb. The ones which are most problematic are the submucosal ones. These are the ones which cause heavy bleeding, they may cause infertility or inability to become pregnant, they can cause pain. So these are the most problematic ones. The management of these fibroids really depends on how the patient is presenting. The diagnosis is usually by the symptoms, by an examination by the doctor, and by a simple sonography. So the commonest fibroids which cause problem, like I said, are the submucosal ones, and these can be treated very easily by hysteroscopy. Hysteroscopy is an instrument by which we put a camera inside the womb through the natural passage. So there are no cuts, no stitches. We can actually go directly inside the womb and shave the fibroids off under a camera. So we can watch this whole process on television, and the fibroid can be shaved off maybe within 20 minutes to half an hour. The procedure is so painless that the patient may go home in one day completely cured of all her problems which have bothered her for a long time. So submucous myomas, excellent outcomes, whether it is relief from bleeding or from infertility or from any such other problems. The other fibroids, whether they are large intramural ones or big fibroids on the outer side, they can actually press upon the urinary bladder or on the rectum, and they can cause pressure symptoms and a lot of other problems. So when they are very large, these fibroids need to be removed, and today almost all of these can be removed laparoscopically. Laparoscopy is what we call keyhole surgery or endoscopic surgery, where on the abdomen there are just small cuts, half a centimeter to 1 centimeter cuts are made, and through that we introduce the camera as well as instruments. An entire fibroid, even if it's large, like a watermelon size fibroids, also we have been able to remove through this small keyhole surgery. Once these fibroids are removed, they have to be made into small pieces inside the abdomen itself, and they are removed bit by bit by a process called morcellation, because the cuts on the stomach are very small and you can't remove large tumors out of these tiny cuts. So laparoscopic myomectomy, as this process is called, is today very standard. Rarely we have to do an open surgery or cut open the abdomen to remove these fibroids. So whatever the size, whatever the number, they can be removed laparoscopically as well. Today we have a new technology, MRI guided focused ultrasound, by which without any operation, without any cuts or stitches, you can actually treat fibroids. The patient has to actually lie in the MRI machine for around an hour and a half, and with a laser light heat, we can actually burn the fibroids bit by bit. So this operation is fantastic because it's completely no surgery, no cuts, particularly for young girls, unmarried girls. It's extremely important that they have this option now open to them. There is very little medical treatment for fibroids. There are some new tablets which have come in, but all of them work by actually stopping the periods and reducing the hormones in the body. So if the periods can be stopped by medicines or injections, the fibroids may temporarily reduce in size, they may give some symptom relief, but eventually once the medicines are stopped, the fibroids will start growing back again. And so there is no excellent medical treatment for fibroids. So to summarize, fibroids are benign tumors occurring in young women. They can be treated very effectively in today's times without a major surgery, without open surgery, either by hysteroscopy or by laparoscopy, all of which are very patient friendly, painless, and ensure very rapid recovery for the patient.